Hi, congratulations on getting the cheat sheet. This cheat sheet has some critical information so that you can effectively use curcuminoids and omega-3 fatty acids to get pain relief. This is a sheet that I prepared for my patients because so often patients are confused about which products to get, how much to take, and how quickly to expect relief. So if I can, I'd like to take just a couple minutes and explain the cheat sheet to you. My name is Dr. Harlan Mittag. I'm a chiropractor. I've been in practice in the Minnetonka area for some 33 years. The goal in my clinic is to get people completely out of pain within 90 days or less so that they don't have to rely on pain medications of any sort, and so that their activities and lifestyle is unrestricted by pain. So let's look at the cheat sheet. So here's the natural pain relieving supplements cheat sheet. This is an information sheet that I give to my patients so that I know that they're getting good products. The two supplements that I recommend for relief of inflammation and therefore pain are the curcuminoids and the omega-3 fatty acids. And these two supplements work differently. If you look at the diagram here, you have on the left, you have an injury to tissue, whatever type of injury, whether it's a sports injury or a car crash or arthritis, recurring injury of osteoarthritis. That generates inflammation, which in turn causes pain. The curcuminoids block two key enzymes, the LOX and COX enzymes, that are involved in generating inflammation. But unlike the NSAID drugs like naproxen and naproxen and ibuprofen, the curcuminoids don't have negative side effects. So you can take the curcuminoids, get the relief without risking the negative side effects of the NSAID drugs. But there's one thing that you really need to know with curcuminoids, and that is you have to get a brand that is highly absorbed. So the issue with curcuminoids is that they're poorly absorbed in the body. Some people take turmeric, and turmeric is the spice. Curcuminoids, the active ingredients in turmeric, make up 3 to 10% of the total turmeric. So you want to take curcuminoids instead of turmeric. But curcuminoids themselves, or curcumin itself, is only poorly absorbed. So over the last decade, researchers have found that you can increase absorption by combining it with black pepper or biopurine. This increases absorption 4 times. But there's been 2 brands that have been developed. One combines curcumin with gum guaiac in a brand called Curcumin. This increases absorption 31 times. And curcumin that is micronized with phytosomes in a product called Meriva increases absorption 51 times. So I recommend Meriva to my patients so that I know that they're getting a curcumin product that is very well absorbed into the body and that will really have some benefit. The next supplement that I recommend to all of my patients, or to patients who are suffering from chronic pain or acute pain from inflammation, is omega-3 fatty acids. And the reason for this is that omega-3 fatty acids fuel a group of chemicals in the body that naturally reduce and resolve inflammation. Research at Harvard over the last 10 years has discovered these compounds, which most of medicine still doesn't know about. They're called resolvins and protectins, and they are made from omega-3 fatty acids, which has to be available in the diet. Our body cannot make omega-3 fatty acids on its own. So to get the omega-3 fatty acids, I recommend fish oil. The reason being that the form of omega-3 fatty acids found in fish oil is what our bodies can use directly. Vegetarian or plant sources of omega-3 fatty acids have to be converted in the body, and this is an inefficient process, so you have to take a lot more of the plant version of omega-3 fatty acids. When you're buying a fish oil product, there are several things you want to make sure of. One is that the fish oil is cleaned of the toxins now found in the ocean, and the best process is called molecular distillation. You also want to make sure that the omega-3 fatty acids are concentrated in the oil. Fish oil can be anywhere from 25% to 70% omega-3 fatty acids. The more highly concentrated forms are given the trade name pharmaceutical grade fish oil. So you want to look for a highly concentrated, preferably 70% omega-3 fatty acid. And finally, you want to make sure that the fish oil product has antioxidants added to it. Another major problem with fish oil today is that it goes rancid on the shelf unless it has antioxidants added to the oil so that it has a shelf life. So those are the two supplements, curcuminoids and omega-3 fatty acids. The cheat sheet has a lot more information on it, but I just wanted to emphasize a few points that were prime points for you to consider. Now, natural anti-inflammatory herbs and nutrients are just part of an overall strategy that I use in my clinic to help patients resolve acute and chronic pain in 90 days or less, and to be done with it so that they don't have to rely on medications in the long term, and so that they return to full function. In the clinic, I take patients through 3 tiers of treatment, really, starting with diagnostics, moving into a range of holistic treatments, and then finally instructing and showing patients how to manage home care or guided self-care outside of the clinic. And let me run through these just very, very quickly. Diagnostics begins with a health history, which includes a general health history, a medical history, history of diet, family health history, and then history of the specific pain area or complaint. Then we move into looking at prior diagnostic imaging or ordering any x-rays or MRI scans that might be needed. And finally, if appropriate, if necessary, moving into what are called functional medicine evaluations, which includes things like nutritional testing, testing for toxicity, and even some very specialized immune system testing. A good and clear diagnosis then allows a very directed and strategic treatment plan in the clinic. And this begins with treatments in the clinic, including chiropractic adjustments, acupuncture, PEMF, which is pulsed electromagnetic field therapy, and also a marvelous therapy called frequency-specific microcurrent. Then we also suggest, as I've indicated, natural inflammatory nutrients and herbs, which I've described here. We also use in the clinic assisted stretching exercises to resolve and release adhesions or scar tissue that has built up from a history of injury, and this restricts movement and restricts function of nerves and muscles. Finally, we then move into directed home care, which starts with stabilization exercises, so you're shown how to do specific exercises to stabilize the area of problem. We give guidance in diet if necessary, including an anti-inflammatory diet or other specific diets. And finally, we also look if there are issues with energy levels or sleep, getting deep sleep, things that affect your long-term ability to maintain healing. We look at those and make recommendations to keep you at a high energy level and to help you maintain optimal health long-term. So that's my clinic strategy, to take people who are experiencing acute or chronic pain and to promote the healing response and get you pain-free in 90 days or less, so that you don't have to rely on pain medications and you can be mobile in your life and exercise and do what you want to do. If you have a health condition, chronic or acute pain or other health condition, I hope you won't let it stop here. If you have any questions, please feel free to give me a call or to email me. Sometimes you'll have to leave a voicemail, but I'll respond as quickly as I can. The clinic is located in Minnetonka, and I accept most insurances. Be glad to talk to you about any question that you have in mind. So please don't hesitate to give a call, and thank you for listening.